Hi guys, welcome back. So let's continue our lecture. Let me share my screen. So today we are going to talk about the bone repair. And so how does bone do the repair? So bone is a living tissue or living organ. We know that bone is a vascularized. It's a living cells inside. And so bone is pretty good at doing the remodeling and the repairing. And so how does bone do it? So when there is a damage to the bone, we call it a fracture. So fracture is damage to the bone. Um, there are different type of the fracture or different severity of the fracture. We can have the closed fracture versus an open fracture. So if the fracture leading to the opening of the skin, then it's an open fracture. If it's only inside of the skin, it's called closed fracture. Of course, in either way, then the treatment procedure will be different. We may have a less severe type, such as the fracture is not totally uh, dislocated. It could be just transverse fracture, or the fracture surface can be spiral fracture. We could also have something called comminuted fracture, a lot of smaller pieces coming out of it. If the fracture coming from the strong, like a compact onto the longitudinal side of the bone, then we may have impact fracture. We also have something that's only a small broken of the fracture, not completely. It's called green stick. We can also have a oblique fracture. So there are different kind of fracture, and then the treatment will be different. What we eventually want to do is to put these ends meet each other and then allow it to heal. So that's basically what the procedure, the overall goal of this procedure is to allow these two ends meet each other and allow it to heal. So how does bone heal? So first of all, so here are different type of fracture, just a little bit like a more descriptive summary about what we just talked about. Transverse, oblique, spiral, etc. So different kind of type of fracture. But how does bone heal? So bone heal goes through about weeks to months. And here is what we have. So what you need to know here is that mm, the thing to make bone heal is because we have the um, we have uh, we have the chondrocyte, which forms the uh, cartilage. And basically it's go over again. Like we have the cartilage and then uh, osteoblasts coming in, mineralize it, and then create the connection. And so that's that. So what we have here is that, okay, after a fraction, you're gonna tear apart the blood vessel, so a lot of blood coming out of it. And here, what you see here is periosteum, like membrane. Inside you have the fraction. So you have the blood coming out, but eventually it gonna bleed, but eventually it gonna clot, it gonna seal. And when it seals, you're gonna have a lot of this clot blood. It's called hematoma. So we have this reddish, like blood present in around your fracture. So that's that. And then this hematoma is going to get dissolved away and be replaced by cartilage. So this is how the bones start to get healed. So these two sides of the bone need to be aligned. And then when they aligned, we allow these environment to allowed the chondrocytes to form the template model, right? So these chondrocytes coming in, and then they will secrete the cartilage matrix, and then it will just temporarily connect two bones while presenting a template for osteoblast to come over to to hardening this tissue. And so what we see here is that we're gonna see the blood vessel start to repair itself, and then the chondrocytes come in, provide this cartilage. This cartilage has a name. This cartilage is called callus right here. So we have the internal callus. We also have external callus. So basically, if it's surrounding the periosteum, it's called external callus. If it's inside of this medullary, here is medullary cavity. Inside of this medullary cavity is called internal callus. Yeah. So we have this callus. Basically, callus is cartilage. It could be the quiz question, like which of following describe the callus? Callus is basically is cartilage. And then this cartilage will be mineralized by osteoblast. So when you have the blood supply coming in, it will bring in the osteoblast. Osteoblast will then secrete the mineral surrounding themselves and then trap themselves inside of this laguna, and then these cells then become the osteocytes, and then it will basically become part of the bone again. So that's how bone form. Yeah. So this will take when you have this callus, this cartilage, it takes about bleeding is stop bleeding is pretty quick. You have something like basically your blood stop bleeding in minutes, and then you will have this blood clot surrounding your injured area. And it takes a couple days, then this clot will get dissolved, get detached, removed, get just, falling apart. Then you allow the space for the chondrocytes come in. So callus formation is pretty quick, like a couple days, you will have the uh, callus formation. So the very important procedure right now is to make sure that two ends of this bone are aligned pretty well. So you allow when they grow together, they will grow together in a right orientation. However, the ossification takes longer time, takes weeks to months. So you basically need to case your fracture so it's not dislocated. And what you can do is just waiting for them to be hardening. Yeah. So that's that. So pretty, promising. It's not like hopeless, right? It's pretty hopeful that our body are able to repair our bones. Our body is pretty good at repairing our muscular skeletal system. The bones, the cartilage is harder because cartilage doesn't have the blood supply. The muscle repair is also pretty constant. Yeah. So that's that. Yeah. So here summarize the procedure, the steps of this bone repair. Basically, there are 3-4 steps, right? So first is not exactly a step, it's a hematoma. It's a bleeding. So if you break it, you're gonna have the blood, and the blood formation is the bleeding. That's the hematoma. What you need to know is that, okay, how do you start to connect these two ends together again? So the key here is the all chondrocytes to form the cartilage. However, here we have the terminology for this cartilage. It's called callus. Plural is called cartilage. Okay, and then we have this callus. Then they will be hardening by the osteoblast. It's called ossification. Ossification is like you have this soft cartilage, but it will be hardened by the ossification. And once we have this done, then it basically connects all these two ends together by the bone. So you have the new bone presented between these two ends. And then it will take a little bit longer time to remodel itself, although it's bone there, but it may not function as it's supposed to be. So through our training and exercise, uh, physical therapy treatment, basically, then you can modify this bone to allow it to grow into the position and the space that fits the body activity. So, so that's that. With this, we know that bone is very moldable, like it can be modified, its life organ is vascularized, it's growing. So one thing we need to know here is that, how do you bring this to your daily life? One thing you need to know is that this bone density is decaying over time. So here, what I'm showing here is the age and the bone mineral density. So we saw this bone has this hold on. Yes, come. Oh yeah. Woohoo! Oh yeah. Woohoo!你如果要去，你要去外面去，你下面很冷。没有，我很冷了，还在外面吹。觉得他感冒了，不要去出去。因为他生病，他痛，你就得。是啊，想法的。你下面的。买进我是可以吃的人。我也活自己。是啊，这两天吃的。我可以吃的。挑一包啊。一个包。你挑一包。然后把肚子给我收好。不过我这回就 recording 了，那么再 recording。 So you can see that the bone is pretty dense, right? So the bone tissue is the cells are partially distributed, but the bone tissue is pretty dense. So you can probably see something like here, right? So the bone tissue is maybe here. Yeah, bone tissue is pretty dense. Bone tissue, this one is pretty dense. But this density decay by aging. So so you can see it's right here. So that's why I want you to know. You know, I know guys, you guys are young, you guys are healthy, but you need to prepare, you know. The bone is getting when we are getting older, just you know, year after year, your bone density will also gradually decay. So here is bone mineral density. This one is fracture threshold. That means that it's easy to get broken. So it's kind of scary, right? Your bone is pretty strong, but by this threshold, it's very easy to get broken. And so one thing that how do you improve it? How do you prevent it? Or how do you delay these bone mineral density decline? The way to do it is exercising. So here showing you that in average it decay, but if you don't exercise, you will be quicker to reach that fracture threshold. If you exercise more, then you will basically prevent it become the fracture threshold. So here is bone change over time. The graph shows that how bone mineral density BMD falls with age. The middle line shows the bone mineral density of an average woman. So this is female over time, and the other line shows the BMD of active and sedentary women, respectively. So female basically after the post menopause, after the protection from the estrogen, then their bone can become quite fracture, quite quite mm, their bone mineral density will decay. Yeah. So aging exercise is important. In addition to exercise, nutrition is also important. So what kind of nutrition you need to consider? Nutrition including the calcium. So you need to have enough calcium. I see a lot of people trying to prevent their bone mineral density loss by taking calcium. But taking calcium is not enough, or it could be useless if you don't have enough vitamin D. Here, what I'm showing you here is that, okay, this is your intestine, your gut. So when you take the calcium coming into your stomach, coming into your intestine, and it need to get absorbed into your body. However, the absorption of calcium depending on vitamin D. So these red dots represent vitamin D. Vitamin D coming in acts on vitamin D receptor, and with that, it will produce the calcium transporter. This calcium transporter then allow your calcium to be absorbed from your lumen, like your small intestine, into your body. So you need vitamin D. Without vitamin D, it will not produce the calcium transporter. Then even no matter how much calcium you eat, it will not come into your body. So vitamin D is critical. How do you get vitamin D? You can get vitamin D by getting sun exposure. Sun exposure, your skin can convert the your bodies into this is cholesterol derivative is called 7-dehydrocholesterol. So don't worry too much about this then. But what you need to know is that okay, sun exposure can allow your body to produce vitamin D, an active vitamin D. So first, it will produce the intermediate uh, member of this vitamin D, and then through the liver and the kidney, it will convert it into the active form of that vitamin D. This active form of vitamin D is called calcitriol. This term you might need to know because uh, in the textbook it mentioned many times. So calcitriol is the active form of the vitamin D. Yeah, your body basically convert it from the cholesterol derivative. That's why vitamin D is lipid um, dissolvable because it's cholesterol. Cholesterol is lipid. Yeah. So that's how you get the vitamin D by getting sun exposure. Is that a good idea to get more sun exposure? It's not a good idea, okay? Because sun exposure also provide you with UV light, ultraviolet light, which is going to, increase the risk of skin cancer. So it's not a good idea. And besides, for people with a darker skin, uh, mm, their skin pigments protect them from the sun exposure. However, with that pigments, they also do not have this UV to produce vitamin D. So for my fellow students who has darker skin, it's very likely that it's more likely that your body need vitamin D because of this pigmentation. It help you protect you from the skin cancer, from the UV light induced skin damage, but it also reduce the production of vitamin D. So this is already commonly known, especially in the military. People need to build their body with the strong bones and the strong muscle, and uh, uh, and you will be surprised that um, many of these soldiers actually has a vitamin D deficiency. And so one thing to overcome that is to receive. It's not just sun exposure, it's to receive, to take a vitamin D supplement. So that's an easier way. Yeah. So that's that. Vitamin D is important, calcium is important. But vitamin D is needed so you can absorb the calcium. This one summarizes all these nutrients that beneficial to our bone tissue. Calcium, vitamin D, so you can get this from the supplement. Nutrition means that's something you can eat. You can get vitamin D by sun exposure, but also get from the food or from supplement. Vitamin K is important too, helping with the bone mineralization. All these mineral calcium, uh, fluoride, magnesium are also important because they are part of this bone mineral. Omega-3 fatty acids is associated with the anti-inflammation, and so it can reduce the inflammation. So basically, overall, omega-3 is good. It's not just the bone, but throughout our body. Uh, yeah. How do you get the omega-3? It's unsaturated fatty acid, and so basically you can get it from the vegetable oil. Yeah. Our body also has produced different kind of hormone that regulate the bone development. One thing you need to know is, or several things you need to know are these. Growth hormone are produced to stimulate the bone growing. Thyroxine is a thyroid hormone. This one is also stimulate bone growing. Sex hormone also, these are all related to the growth hormone. Like sex hormone in female is estrogen, in male is testosterone, and then by puberty, those basically build your body to develop the sexual characteristics, muscle, bones, etc. Calcitriol basically is an active form of the vitamin D, so we talk about that. Uh, Parathyroid hormone and the calcitonin are associated with the calcium regulation. If your blood calcium level is high, calcitonin can reduce that blood calcium level and store those in the bone. And so when it stores those in the bone, it inhibits osteoclast. So basically, it inhibits these uh, bone mineral loss. It inhibits that. It prevents mineral loss by osteoclast. Increase the calcium uptake. Store this calcium in the bone. If your blood calcium level is low, and then you're supposed to take in calcium, but if it's remaining low, then parathyroid hormone is going to go to the bone to extract the calcium out of the bone. And then this calcium will then go into the body, go into the blood. So it will stimulate the osteoclast to chewing the bone and then release those calcium into the body. Promote the reabsorption of calcium in the kidney, you don't secrete them out, and increase the calcium absorption by the small intestine. Basically, you will get the calcium from the bone and also from your urination. You don't pee them out, you take it in, and also from your food, from your intestine. And so that's that. All right. So this portion of the video finish our lecture of the skeletal system, and I hope this is helpful. And let me know if you have any questions.